Welcome, welcome, welcome in everyone. Welcome to Care Concierge with Care Patrol, where education is the heart of everything that we do. We appreciate you being here today for our topic, IDEA, inclusion, diversity, equity, and accessibility, navigating the sticky floor. This topic, like the majority of our topics on Mondays at noon via Zoom, are suggested by former attendees of other topics. And as I got into this, I realized perhaps that the person who suggested the topic meant for it to be two separate discussions. And it very well could be. But I think that if we address the inclusion, diversity, equity, and accessibility aspect of our workforce and workplace, I think we can also begin to address navigating the sticky floor, because I think that there's commonalities that you may find interesting. So thank you for being here with us today. If you're new to Care Concierge and Care Patrol, we're aging care navigators. And what that means very simply is that we meet people where they are in their healthcare journey, whether that's in the planning stages of earlier in life, or if that's in the ER or post-discharge. We help people understand what options exist for care among Medicare and Medicaid services, as well as private pay services. And if our clients choose to move to a community or use a sitter service that we recommend, then we're paid. That's how our business works. What separates us, I think, is that we do focus on education, not only today in this Zoom, but with our clients as well, about what's truly in their best interest. And it's not uncommon for us to recommend the majority of services, in fact, that we recommend are not services wherein we'll ever receive a commission. So we're truly here to help, and I hope that those of you who have folks in need will allow us to do so at your convenience. If you have someone with questions about what's next, let us talk to them. We can let them know what's next and how they're going to pay for it and how to get started. So thank you for being here, those of you who are new. I know we have a larger than ordinary audience, and I'm most appreciative to those of you who've joined us for the first time. We do encourage discussion. So if you're new, each of you has the opportunity and the ability and the power to unmute yourselves. So if you'd like to join in the discussion, which I hope you will, please just feel free to jump right in, or you may be more comfortable using the chat room. To access either your mic or the chat room, move your cursor to the top of your screen or the bottom. A black bar will appear. On that bar is a microphone icon that you can mute or unmute. And there's also a chat icon. Click on that and let us know how you're doing, where you are, and any questions or concerns or anything at all that you may have. In order to receive a credit for this hour, we're accredited by the Alabama Boards of Social Work and of Nursing to provide 1.0 contact hour. In order to receive credit, you must do the evaluation. The evaluation is password protected. And because of this, the Alabama Board of Social Work sees this hour as a live or classroom hour, not as a recorded hour. So this is why we use a password. We give the password at the end of today to show that you were here, of course. And we use an online survey. Those of you who've been with us and know that if you're not at your screen or not able to see the screen, I'll read for you now the evaluation link that you will use to get credit for this class using the password we provide at the end. The link is https://www.surveymonkey.com/r/ all uppercase letters 2 B as in boy 7 H as in hat, C as in cat, R, Q. That's our evaluation link. Again, the password is provided at the end. Everyone who does the evaluation will receive credit and will receive a certificate and this presentation in your email, and nurses will be posting your hour for you. Thank you, Ms. Talbert, as always, for posting the link for us. It's good to see you again today. Let's get started with IDEA, inclusion, diversity, equity, and accessibility, navigating the sticky floor. We have three objectives today. One is to discover the parts of the IDEA framework. Objective 2 today is to discuss the elements of the sticky floor phenomenon. And 3 is to list some activities and tools that we hope that you can use both to combat IDEA exclusions in your career and to help you rise from the sticky floor yourself, if in fact you feel yourself to be there. So how familiar are you with IDEA, inclusion, diversity, equity, and accessibility? Is this a new topic for you, or are you clearly here because you know what it is, but you'd like to learn more? Are you very familiar, any of you, with IDEA, inclusion, diversity, equity, and accessibility? If so, please join in the discussion via your microphone or the chat room. And please know that I feel and I truly believe that this discussion is much more enhanced when you add your voice to mine. So please do jump in. So it's an acronym, clearly, IDEA, and it stands quite obviously for inclusion, diversity, equity, and access, or sometimes accessibility, depending on where you see it. And the idea of IDEA is to highlight underserved communities by addressing structural inequities within systems and organizations. And this allows us, or the systems and organizations rather, to foster cultures that then minimize bias and recognize those systemic inequities that, if left unaddressed, will continue to create certain disadvantages for certain individuals and for certain groups. Now, a framework that promotes organizational excellence and positive change is one that includes IDEA at its core. So a study conducted by Deloitte found that, organizations that had more diverse and inclusive cultures are more likely to experience higher levels of innovation, employee engagement, which would clearly lead to innovation, and financial performance. Again, tying back to employee engagement, because those organizations are seen to be and are more responsive to diversity. A report by McKinsey, and McKinsey and Deloitte are just consulting firms that consult various large corporations and others on different topics. A report by McKinsey found that companies with diverse executive boards are more likely to have higher financial returns than those with less. And a study by Glassdoor, which is essentially a hiring sort of website, found that 67%, 2/3 of job seekers consider diversity and inclusion important factors when making a decision about where to work. And so it's clear then to organizations that prioritizing IDEA initiatives can increase their appeal to employees and their financial standing, as well as retaining existing employees. Oh, we've got comments. Ms. Young says that the IDEA is a new topic to her. Ms. Phillips says, yes, she's attended some trainings related to this already this year. Well, thank you for coming to this one. Ms. Clardy says, it was extremely focused on in social work, university curriculums post-COVID, George Floyd. Well, ladies, I hope I can do justice to a topic that you probably clearly know more about than I do, but let's do our best. So inclusion, if we want to attempt to sort of define it, would be the recognition, appreciation, okay, and the use of talents and skills of people of all backgrounds. That is inclusion. Simply having a diverse workforce does not guarantee that you have an inclusive culture. There can be informal segregation within certain roles or within certain groups that are dominated by certain roles or groups. Now, inclusion instead refers to a workplace culture that recognizes, accepts, and values diversity rather than merely displaying it. These are environments where everyone feels welcomed, respected, represented, supported, and valued to fully participate. Can you think of any individual or group who might not feel a sense of inclusion within your workplace, or maybe, to be less personal, the workplace, in a workplace in which you've been associated? Can you think of any times that there would be a lack of inclusion felt by some group or individual within that workplace? And what do you suppose can be done about it? I look forward to hearing from you. So here's an example. If an organization, in terms of inclusion, if an organization learned from either a survey or its own record keeping that it didn't come off as welcoming to people who were physically challenged, then what might it do? Well, it might do any number of things, but it could host a focus group, for example, and then I ask feedback. Well, if it's the case that we're not welcoming, why is that the case? So if it was a clinic, for example, their suggestion might be that there would needed to be additional room for wheelchair access. And that might include everything from removing certain chairs or seating or tables in the room to widening doors or adding ramps or other things, enlarging restrooms. Now, not all of these could be done at once. Maybe not all of these could be done, but something such as removing tables from the waiting room could be done. And the point of the exercise really is this: you show inclusion not only by what you can do in terms of the feedback, but by simply asking for the feedback in the first place. That is inclusion. So if an organization then was described to describe the diversity of its client base, and they described only the racial diversity, would that be inclusive? Ms. Phillips says any minority group can feel this. Things can be done, more awareness, cultural competency, more trainings like these. Thank you, Ms. Phillips. So if an organization was asked to describe the diversity of its client base and they described only the racial diversity, would they be inclusive? This is intuitive, of course. I'm sure all of you know and aren't taking the time to answer what's almost a rhetorical question. But we know that within every community, there are separate communities, identities, races, ethnicities, backgrounds, abilities, cultures, and underserved communities. So even in a group of people who mostly from the same demographic, the similar racial or ethnic background can experience different economic backgrounds or be of different ages or physical abilities. All the ways in which we differ are diversity. And while we often discuss differences in terms only of race or ethnicity, or maybe of gender, the broader definition would also include our ages, national origins, religion, disability, sexual orientation, our socioeconomic status, our education, our marital status, our language, our physical appearance, our geography, and any other identifiers about us. These are the ways in which we differ. We've done units on this, on cultural competency and cultural diversity. There are at least 24 different cultures residing on this phone call within each of us. These are the ways in which we differ. Diversity in the workplace is, in fact, even more multifaceted. And it includes internal diversity. These are the traits such as gender, age, race, and ethnicity that are innate and unchangeable for each of us. There's external diversity, which is our education, our work experience, our socioeconomic background. These characteristics have been learned and can be unlearned. Thirdly, our organizational or functional diversity within the workplace is where assigned roles within the company or organization, where individuals are able to bring their unique skill sets, perspectives, and ideas. And then fourthly, there's worldview diversity. And this encompasses the previous three: internal, external, and organizational or functional diversity. Worldview diversity encompasses these three and adds political beliefs, moral values, epistemology, which is very simply what we know and how we come to know it, or what we think we know and how we come to know it, and our outlook on life. And what we think we know and how we come to know it is key in recognizing diversity, the other tenets of idea, and in navigating the sticky floor. An inclusive workplace values and respects diversity and sees it as essential. I would suggest to you that as individuals, you would see diversity as essential among your peer group. Is equity the same thing as equality? Is equity the same thing as equality? They're very related. They certainly seem to be alike. Ms. Smith says no. Ms. Gibson, no. Ms. Cronin, no. Thank you all for answering. I appreciate you. Ms. Aaron, no. Ms. Ross, no. A resounding no. Thank you for being ahead of me already, ladies. With equality, everybody gets the same piece of pie. Now, this assumes then that everyone wants pie, or is hungry for pie, or can eat pie, or will eat pie. And so it may seem equal if a company, in this case, a nuanced example, provided the same tools to everyone and facilities to everyone. And so you may all have a handheld device for patient check-in, but while you're all given that tool, that doesn't mean that each of you have been accommodated, because there may be someone who needs some additional accommodation to use that tool. This would be that person being given an equal opportunity to succeed, regardless of the unique needs or ability that requires them to have an additional aid to access this tool given to you by work. So promoting this equity then, or creating policy or policies that ensure greater meaningful participation by everyone, can build the culture that values and supports diversity and inclusivity. And so equity builds the culture that supports diversity and inclusivity. And so let's say an example that's maybe more accessible back to this tool. Not everyone comes from the same access point. So someone may need a handheld device that has larger print, or that has a different color font and background than is traditionally seen on that program or tool. Or they may need translated materials related to the language that that tool uses. And so that is equity, providing that accessibility to the person. Equity is all having the opportunity to fully participate, perform, and engage. And Ms. Montreux Hutton says, yes, equity and equality are different concepts. Equality aims for everyone to have the same resources or opportunities, while equity focuses on distributing resources and opportunities based on individual needs to achieve fairness. My goodness, I wish you were sitting in my seat, Ms. Hutton. Equity encompasses policies and practices used to ensure fair treatment. We almost might use Ms. Hutton's words here, but we also are also at the same time and looking for fair treatment, looking to identify and eliminate barriers to fair treatment, barriers that have historically prevented full participation. Okay, systemically and historically, unlike equality, which focuses, excuse me, only on equal distribution, equity also considers outcomes. Outcomes. Equity addresses outcomes. So for equity to be consistent and systematic and fair and just and impartial, then all individuals who belong to underserved communities that have been denied treatment should be included. Equity would also include these folks: Blacks, Latinos, Indigenous and Native Americans, Asian Americans, Pacific Islanders, other persons of color, members of religious minorities, LGBTQ plus individuals, people with disabilities or different abilities, people who live in rural areas, which we don't often think of, persons other adversely affected. And so I'm suggesting to you now that IDEA includes not just those who may, or equity and access, not just includes those who have physical challenges, but those who have historic and physical and systemic challenges to getting ahead in life, which is tying us to the sticky floor. In what ways can you see that your workplace may not offer, or may offer rather, equality without equity? Now, again, this is a personal question, so you may not answer about your workplace, but any workplace. Have you been in a workplace and where you felt, and the workplace felt in itself, that they were offering an equal opportunity, and yet there was not equity among that opportunity for everyone to fully engage and participate? Ms. Dean says, sure have. Thank you. That was a good answer. You didn't have to expose yourself or your workplace. I should have asked the question differently. I apologize. So accessibility, as we were saying, is a commitment then for everyone to be included in all programs and all activities. And it is also multifaceted and goes beyond simple physical accessibility of buildings and structures. It includes, as we've just discussed, digital accessibility. It includes ensuring that online content can be navigated. It ensures providing ergonomic workstations, using inclusive language, offering flexible work arrangements, and offering training on creating various content or anything really that would make an organization have greater accessibility. And accessibility encompasses the needs of each person, each employee, and each person who enters the clinic or hospital or lab or wherever you may work, including neurodivergent individuals. So, for example, there may be, and I think we'll see, and we are seeing among the younger generation, a rise of folks who are very capable, but who have some issues with processing. And so they may need to be allowed to have a headset on during work in the office place, or the door shut, or a quiet room to be. And so we have to think about accessibility in terms of meeting everyone's needs. And generationally, I think we'll see many, many upheavals in the way that we relate to one another. And so here's an idea about creating accessibility. There's a neighborhood pharmacy, let's imagine, that's offering a vaccine. Let's say it's a flu vaccine or an RSV vaccine, something non-political. And they noticed that they pull from the same demographic within their demographic for these vaccines. And they decide that they want to create a broader audience. So they're not seeing what they think is a fair representation of the young people within their service area and the aging people within their service area. And so what they do then is to create access, is to reach out to service organizations that meet the needs of the aging and or young folks in the area and work with them again to create a focus group and to understand where is it that we have a disconnect. And wherein, in this example, they may find that the disconnect is money and transportation. These are the things that are not provided. Good afternoon, Ms. Wilson. So that they then work on a plan. So, you know, the plan is to waive the copay or provide a bus pickup or do whatever. But as a result of their plan and their efforts, they get more people are able to serve, more people are able to work in the public health interest of more people by developing a pathway, an access point, a way for these folks to get there and take part and fully engage and participate in getting a vaccine. That is an example of accessibility. And so how might your workplace address accessibility for staff and patients? Do you have accessibility issues? And remember, we're not simply talking about a ramp or accessibility issues around the physical challenges. We're looking at other challenges as well. Do you have patients who come in who are on the spectrum and need to be perhaps in a quieter waiting room? Has this ever happened? How did you address it? How could it be addressed? How might a workplace or your workplace address this accessibility issue? Well, one thing that I think we can do, or things that can be done, in terms of addressing the idea framework, in terms of addressing, approaching your workplace and your general life with the idea of inclusion and diversity and equity, which is the building block of those, and accessibility, which is the entry point to that. Be committed to a lifelong process of learning and learn to change as a result of that learning. You can participate in trainings like this one and others, as I know you do. Read books, as I'm sure you will, and actively listen in your everyday encounters. You can learn the history of local African, Latino, Asian, Arab, Native American communities, attend public events and develop relationships therein. Seek support from colleagues who feel similarly as you do, that your workplace does need to be more inclusive, does need to provide greater access, both to you as the work colleagues and to others. Seek support and work together to create change. And in your interactions with others, use inclusive and welcoming language. Remember, we're inclusive. We feel welcomed, first of all. And then as you become a subject matter expert on inclusion, diversity, equity, and accessibility, be a mentor to others, be available to your peers as a resource. Essential considerations then, as we move forward in our learning process, would be to ask when we meet a new individual how they prefer being addressed. For example, what gender pronoun they identify. We can avoid dehumanizing language, which would be using a sort of microaggressive other gender modifier without asking their thought. We want to avoid anything that comes off in a welcoming tone as being combative and using terms like confront, combat, tackle, target, These are all assertive things in our language that we can eliminate. When we're talking to someone who has some type of challenge, let's refer to them with regards to that type of challenge and not in the aggregate of people who have a challenge, if that makes sense. And as we are working on modifying, learning and unlearning and relearning our language, we want to look at language that reflects views from across a community of a diverse population and not just the individual with whom we're addressing. So, in other words, there may be someone that prefers to be addressed in a certain manner, such as by their first name, when in fact that community of people would prefer to be addressed as Mr. or Ms. or Mrs. or I'm not sure the non-binary term, but I'm sure there is one, and forgive me for not knowing it. We want to develop inclusive written and verbal communications back to our language. And in that, we're identifying and removing words, phrases, and images like those above or others that could be offensive or aggressive or stereotypic. We want to identify and remove language in the materials that we put out that excludes certain demographics and certain folk. We want to limit the use of the term minority and minorities and define that when used. So very specific. Again, we're looking at people as who they are as individuals, not as representative of some block of people. Now, for additional information on inclusive communication, there's a great website. It's from the CDC. It's listed here in the presentation. I won't read it, but you will get this presentation. And I would encourage you, if you're interested, to visit it. It's a CDC website on health communication. Other essential questions then, after we've made some of these considerations, might be, what is your understanding of blank, this condition, your condition, this test, this procedure? What concerns you most about it? And what is significant about this for you? What is likely, do you think, to be the effect of this? What does your family or others who advise you think? And how can we, you and I, move forward in your best interest? So, and we're having these kinds of conversations constantly, and we want to make sure that we are active listeners when we are working with folks who are older, who are historically underserved, which is a large and vast list, those with limited English proficiency, low income communities, low literacy populations, people with functional or access needs, accessibility needs, people experiencing homelessness or other financial strife, people with so-called disabilities in rural communities. And again, we want to realize that folks in rural communities now are underserved. There's a lack of health care. There's a lack of communication apparatus. There's a lack of quite a bit. And so we're viewing now the rural communities as being just as historically underserved as some folks who may live in a more urban setting. Other essential considerations are to acknowledge, appreciate, and value the differences between you and the person with whom you're interacting. Be very, very cautious, as we've tried to say, about generalizing about any community. Diversity, as you will remember, exists across and within communities with variations in family history, in culture, in norms, in attitudes, behaviors, lived experiences, and many, many other factors. We want to consider the way that people's social identities may overlap with ours. This will help us to better understand and communicate with them. We want to realize always that race and ethnicity are not a proxy for socioeconomic status. We want to recognize that members of all population groups, all demographics, are not all the same in their health and living circumstances. We want to understand that articulating the needs and experiences of our audience on them can help them and help us impact their lives and success or failure of what we're recommending. So, having been through these lists, can you think of any approach in your life or any changes in your behavior that you feel prompted to make that may make you feel more included at work or better able to include others. Miss Aaron. Oh, thank you, Miss Aaron. MX. How do you pronounce that? I wonder. And you're welcome to jump in. You're able to unmic if you like. But Miss Madison, Aaron says, sorry, a little late, but I have interactions with some people who identify as non-binary and utilize the title of MX. I'm not sure how to say that, but I'll try. So what approaches could we make in our own behavior? Well, let me say this. Changing our behavior, in my opinion, and the reason I moshed together these topics is I do believe that if we address the need for inclusion, diversity, equity, and access within our workplaces, if we take that on individually, that we can begin to perhaps combat any sticky floor feeling that we may be having. And so contributing factors to the sticky floor, and again, I think I'm lecturing to the choir here, who probably know all about everything I've said. The sticky floor contributing factors are one, that we have challenges with the work-life balance. So generally, this would be addressing women who feel that, and a high percentage, unfortunately, feel that that taking family time away from work is somehow harmful to both. And it's a challenge, and it's not recognized systemically and historically in organizations. Number two, sticky floor contributing factor is letting perfectionism get in the way. And so I can attest to this myself, sometimes not doing something and waiting to do it, waiting on it to be perfect, when in fact it would have been far better to have done it and worked on it along the way and fixed it along the way versus waiting for a time that ultimately never came. The third thing is waiting for your hard work to be recognized rather than taking control of it and making sure that your hard work is recognized. So much of this rings true for my wife, who started 34 years ago in her work as a receptionist, and 34 years later had created a website and a process that allowed the business to essentially acquire 8 other businesses. Not only was she really never promoted for that sticky floor, but she was waiting for her work to be recognized, and that day never came in 34 years. Now, she is a perfectionist, but she did take the bit and pushed through and created something that was unheard of at the time, using the web and later the app to do something that was unheard of. And so she didn't let perfectionism get in her way. She certainly had challenges with work-life balance. We have small children at the time, and I was traveling a good bit with work at the time. And she was waiting for her work to be recognized, and that day never came. And she was also not speaking up in the moment. She was waiting for the right words for the organic meeting, the bump in the hall that never happened. Not leveraging mentors and creating support networks. She felt she didn't have the option to have mentors, that wasn't an option available to her. And there was no support network. And there was, in her part, I think, a lack of political savvy, knowing how to get her needs met. And part of it, and I think the greater part, was in many ways, not asking for what she wanted. Ms. Dean says, number 3, that is a fine line between taking control of your destiny and being a shameless self-promoter sycophant. I agree, Ms. Dean. I would expect that many of us would have trouble with self-promotion. I certainly always have. And yet it seems that those people who are very adept at self-promoting aren't really very adept at the thing that they do that they promote. And that those who are experts, like many of you on the line, maybe don't put yourself out there when in fact you could, and maybe ought to do. It is difficult. I think the way that you would best go about waiting for your hard work to be recognized in any sort of workplace would not be saying in a shameless way, look what I did. I did all of this. I did all of this. I did all of that. Instead, I think you would approach it from this perspective. Look what I've done. This has saved the organization X. This has created a better workflow for these departments. This has whatever it's done. In other words, when you're promoting yourself, what you're actually doing is promoting what you've done for the organization and how that helps the organization. And then I think when you're asking for what you want, naturally on the heels of that, you might say, hey, because I've done this, that saved the organization and gave the organization and did this and did that, I feel like I could take on a role that would maybe incorporate even more of this. And this is maybe how you begin to ask for promotions and ask for what you want, ask to be a leader. After showing that you have leadership capability by showing your hard work. I believe this is really what they're saying. I mean, each of these can be, to me, a little preachy, particularly I'm a 56-year-old white man talking to you all about a sticky floor. It's a disconnect. I'm doing my best and I am what I am. I was born this way, but I think without being preachy, all of these hopefully create within you some notion of taking on being challenged by these comments, which I think is how they're intended. So y'all know that the concept of the sticky floor are the barriers that prevent individuals from advancing in their careers. Almost always, the sticky floor in terms of the literature refers to the gender difference between men and women in terms of pay and other things. But while many companies claim that they're fair and equitable in this way towards women in the workforce, the sticky floor persists, like the glass ceiling persists. So, in fact, data shows that the salaries of women are less than men when they each have comparable skill sets and experience. That's a truism. It's true. Yet you find now many times that women opt out at mid-career level. And so this can create a bit of a glass ceiling or a sticky floor. And then this is often goes back to, as we said earlier, social issues like child rearing or domestic work. But what I want to make clear here that one of the things that I want you to pull from this, and I just sort of put this comment in, but who you interact with is what's going to lead or not you towards potential opportunities. So if you're on the floor, on the sticky floor with the other folks, and you're only interacting with the other folks on the sticky floor, it's going to be very hard for you to take the next step. And so you need to find some way in which to advance yourself to that person who's on that next step and let them know, hey, I'd like to be on that step too, rather than on this sticky floor. And so who you interact with is key if you're on the sticky floor. Find reasons to have organic interactions with people who are where you want to be. Now, just some sobering news about the sticky floor is the good news is that the pay gap between men and women is narrowing. The bad news is that at the current pace it's on, it'll be another 286 years before it evens out. So the glass ceiling and the motherhood penalty, which is, as we've said, women taking off in mid-career because they feel that not doing so is somehow a mark on their character. that is about 60% of the wage gap. The other 40% is attributable to the sticky floor phenomenon, where women like my wife enter an organization at the lowest level, receptionist, and no matter what they might achieve, are never recognized for what they do. And the problem then with all of those statements we made earlier is that 54% of women worry about how they come across at work or in meetings. So if you're worried about how you're coming across, it's very difficult to advocate and preach about what you've done for the organization. 56% of women in the workforce worry about asking for a pay raise. Although women are, as you know, encouraged to be assertive, as I'm encouraging you now, you may be penalized and are often penalized when you do assert yourselves. 30% of women feel inadequate at work. And the same number, 30%, feel that if they pursue their career, 30%, 1 in 3 women feel that if they pursue a career, they're not a good person, not a good mother, not a good caregiver, not a good wife. 30%, 2/3 of women, and you know this to be true as well, experience harassment and microaggressions at work. 23% of women don't feel they can communicate without being negatively labeled at work. This is harassment and microaggression. 21% report bullying goes unchecked. And to add insult further, the pay gap between a white male and a woman of color is over 28% difference, even with comparable skill sets and experience. And so I'm hammering here, women. What I want you to know is I very intentionally earlier read a list of the various different diverse cultures that exist. And each one of those cultures, whether it be by age or race and ethnicity or religious background or whatever it may be, LGBTQ status, whatever it may be, each of those persons is in a historically underserved population, demographic, like women in this case, in this example. I feel that the sticky floor doesn't simply apply to women or women of color, but persons of color, persons of certain backgrounds, persons of certain educational levels or socioeconomic levels. I think this applies to everyone. So what do we do about it? So what sticky floor barriers have you encountered and how did you react? I'd love to hear from y'all what sticky floor barriers you encountered and how you reacted. So the things I'm going to suggest to you, I think, again, would help you become a thought leader in terms of idea, inclusion, diversity, equity, and access. And that in being that thought leader, you might be able to rise yourself up from the sticky floor and have a reason to interact with leadership and something positive to show on your resume if you started, like my wife, as the receptionist. And so these are called diversity and inclusion activities or DEI activities, and they foster team building, but I think they might also give you a sense of personal belonging in the workplace. One is you might do a snapshot board in a central place. Ms. Van Horn said, let's add age. Yes, ma'am. I deal with age in my life and age, and I have a good book for you in a minute. So a snapshot board would allow you maybe to put a picture of you on a vacation. It may be a picture of your grandparents or your children or your great-grandchildren or whatever it may be. It would be a chance for your coworker to see something personal from you, and it would allow you to have a discussion. And naturally, within the context of that discussion, you would come upon things that make you diverse and different from one another and things that make you the same. So, and then it may encourage that other person, coworker, to do the same. And if you like, and if you get so bold, you can begin to post pictures that will raise questions about diversity or inclusion or access. You might instead feel more comfortable suggesting that we do a potluck lunch. It's the holidays. Why not do something coming up in which everyone brings their favorite family dish for that holiday. And they're asked to discuss that dish. And naturally, you will hear discussions about family culture, which will lead you again to see here is where we differ and here is where we are the same. You can do the same at restaurants if you're not a cook. You might start a diversity calendar next to your snapshot board in which you begin to mark, hey, it's Disability Awareness Week, or hey, it's Black History Month. Or you might begin to look for people to do other things. Religious holidays might be listed on your diversity calendar. There may be things like Music Appreciation Day. You might learn that one of your coworkers plays the trumpet. Anything of that nature, again, is going to build your team, and it's going to show that you have a commitment to bringing diverse people, teammates, together. Now, a book club would be ideal, and I believe I promised a book. So you could certainly choose books about Black history or, Pride Month, or you could choose books about general diversity. So Amazon has many here listed. One is Inclusion, Diversity, the New Workplace, and the Will to Change. This would be more for the person in a managerial role, but it would be a good book for you. Amazon, we can't talk about that at work. How to Talk About Race, Religion, Politics, and Other Polarizing Topics by Mary Frances Winters. And that is a book that not only encourages you to have those discussions, but gives you ways to open those discussions up, sort of activities to do, if you will. There's Blind Spot, Hidden Biases of Good People by Dr. Mazarin Banaji. I hope I said that correctly. This is a more sort of academic look at the fact that we all have bias. This is a human characteristic, he argues, and not a black mark on our character. And so to have bias and understand that we're going to have bias helps us in his thinking to understand what bias we have and to work on assimilating that into our thinking. There is the remix, How to Lead and Succeed in the Multi-Generational Workplace. And that book is for you, Ms. Van Horn, because as I said earlier, I think we see a whole different group of folk coming in the workplace. You know this, if you're in the workplace, and how to work if you're 68 with someone who's 28 or someone who's 38, work with someone who's 48. There's some difference there. It's nuanced, but it will help you to read about it. There's Subtle Acts of Exclusions by Tiffany Jana, and those are more about microaggressions, the things that we say without thinking that are harmful to someone or make them feel excluded. And then there's So You Want to Talk About Race by Ijeoma Alua. I hope I've said her name correctly, which is an entertaining look at, again, how to bring up race discussions at work. Now, whenever you're talking to anyone, you're networking. And if you look at any sticky floor work, you hear, things about you need to be networking. Well, just realize we're working on our communication internally on what we say and how we say it. That's going to come through when we talk to people. That is networking. But if that's not enough for you, you may do the 5-cup challenge, which is picking 5 people that you work with remotely, perhaps, or very not often, do you interact, and take them to coffee and learn about them. And again, learn about what makes them different and the same. There are informal power opportunities that you can take hold of, things like being parts of committees at work. This is a way to advance yourself from the sticky floor. And all of these things start with you being self-aware. What are my biases? What are my strengths and weaknesses? And being willing to make change, to be a constant learner, to be willing to become assertive, more confident, and be able to navigate people who come in the way of you trying to raise yourself from the sticky floor. If you focus on something, it will happen. Look inward, realize and accept that you are stuck. If you feel stuck, be honest and know your values and set goals that work with your strengths and weaknesses. So if you're not someone who would have the ability to put a board up for people to pin something to, maybe there's some other way that you can bring about a discussion of race or difference or inclusion at your work that is suited to your strengths. Have a plan, create a life plan, almost a goal board if you went off the sticky floor. Be willing to do things that are difficult, like create your own board of directors. This might include, people that are, personal friends or colleagues, may also include work colleagues or even your supervisor. And certainly if you have one, a mentor. And then don't let fear stop you, because in the end, what have we got to lose? Particularly if we feel stuck. We know, as Einstein said, that doing the same thing again and again is going nowhere. So let's come down to maybe our closing for the day, which is to navigate the sticky floor. It's essential, I think, for us to create a culture of inclusion and diversity for ourselves with others that recognizes and values the unique perspectives, merits, and skills of all others. And that by doing this for ourselves, we can begin to enact this into the world and into our workforce and help us to have something to hold on to as we try and rise up. Best practices that can help you are identify and address those barriers. Were you hired as a receptionist? Are you seen as only the receptionist? Is a degree problem in the way? And seek this head on. Seek mentorship or training or additional education and ask for help from those with whom you work when you do this. Build your support network. If you don't have a mentor, look for one. And the best way to do that is just to do informational interviews with people that you respect. Hi, so-and-so. I'd love to talk to you about your experience in our field. I'm just looking to broaden my career, and I'd love to know more about what you know. May I have 15 minutes of your time? Use that as a way to say, who else may I talk to? And eventually one of these people will take you on as a mentee. I promise you. Be proactive in this way and seeking out these opportunities, and advocate for yourself by speaking up if you can. I know it's difficult, but it will help you gain visibility and stay informed. Again, if you're a subject matter expert, you will be pulled up within your organization. That's our CEU for the day. It was a lot of information. I hope I covered it. I hope it was worth your time, that given that so many of you were here. Our CEU code word, password for the evaluation, is access, and that's a capital A and then lowercase CCESS. Access is the password for our survey. The link, again, for those of you who need it, is https://www.surveymonkey.com/lowercase r/all uppercase letters 2 B as in boy 7 H as in hat C as in cat RQ. That's our SurveyMonkey evaluation link. You must do the evaluation in order to receive credit for this hour. Nurses, we will be posting the hour for you. Everyone will receive a certificate and this presentation who does the evaluation. Thank you all. Yes, everyone will receive the PowerPoint. Thank you all for being here so much. Remember, Care Patrol, if you have someone in crisis who needs to know what their options are, we'd be happy to help. And we're no charge to them. We're paid by the providers. And join us on Monday of this coming week when we will tackle, excuse me for that word, when we will look at seasonal depression with Dr. K. Nicole Brown. So on Monday of next week at noon via Zoom, seasonal depression with Dr. K. Nicole Brown. Thank you all for being here today. I hope you have a very blessed and great week. Well, trying to end.